Welcome to the Learning Lab. My name is Roman Garcia. What we're going to be discussing today is the possibilities of being able to predict knee arthritis before the individual or the patient starts to experience pain in the knee or functional decline from the arthritis. Now, in medicine, the holy grail of medicine has always been the ability to be able to predict a disease, which thus far in the medical industry, that possibilities in most medicine, in most medical condition, does not exist. But I believe, and I'll show you in a little while why I believe this, that to be able to predict knee arthritis is a very likely reality. So what I'm going to do right now first is I'm going to show you a general concept or a general idea so you can follow along as we move along in the video. But what I want to show you first is a little bit of anatomy of the knee joint, so you can get a greater understanding when I end up showing you x-rays of what I'm trying to explain to the folks out there. So if we can go here first. Now, what I've got here is a rough picture. It's a rough picture of the lower leg bone. This is the tibia. This is the tibia. This is the tibia bone. On an x-ray, is the lower bone that makes up your knee joint. This is a rough schematic of it, but the shape is relatively close to reality. This is the upper part, and this is heading towards your ankle. Now, in the tibia itself, there is a certain line that is very defined on an x-ray. That line is called the growth plate, and I'll show it to you in a little while on the x-ray. The growth plate lies or lays just underneath the joint surface, which is right here. The joint surface is right here. The upper bone comes down here. It comes down like this. This growth plate is a space of transition where before an individual reaches 21, it is that segment of the bone where length occurs, so the individual has the ability to grow into a full adult. Now, when you're under the age of 21, this growth plate right here on an x-ray, it gaps. You can see a space in this growth plate. But when you reach maturity, this growth plate, because you finish growing, this growth plate seals itself off. But this growth plate on an x-ray, no matter how old you are, it's always easily identifiable on an x-ray. And I'll show you in a little while how it looks on an x-ray. Now, when an individual, this is my observation, when an individual has a predisposition or is on the verge of developing either inflammation or arthrosis in the knee joint, this growth plate on an x-ray will disappear. It is one of the first signs of an impending arthritic or arthrosis condition in the knee joint itself. So observation has shown me that by monitoring how well distinguished this growth plate is on an x-ray, you can predict whether that individual will be predisposed or have arthritic changes in the knee joint in the future. It is a predictive sign on an x-ray. And I'm going to show you in a little while how it looks. But first, what I want to show you on a real knee with the help of my assistant Anna, where the growth plate is. Now, this is Anna, and what I've done now is this, more or less, this is the joint space right here. The joint space is right here. The joint space is right here. The joint space is right here. This is the joint space. This is the tibia as we saw in the figure on the diagram. And then this is the long leg bone. This is the femur. They come together. They come together right here. The growth plate will be about a third of the way down from the surface itself. The growth plate will approximately be right here. As Anna was growing, this is where the growth occurred. It occurred right here at the growth plate itself. Anna is still very young, but she's finished growing. So this growth plate on her has sealed, like it happens on everybody once you pass 21 years old. This is the left knee, obviously. This is the right knee. This is where the growth plate would be on the right knee. Now, Anna, you're going to lay down. Now, we've gone through this before. A very sensitive test for knee arthritis or knee arthrosis and knee arthritis of the knee is this extension. We already know that as the person starts to develop deficiencies in this knee extension, they are developing arthrosis in the knee joint itself and arthritis. Now, the sign that I'm going to show you on an x-ray is a sign that's much more sensitive than this knee extension is. And all it takes is a simple x-ray. Now, what I want to do now is I want to show you on an x-ray where that growth plate is. Alrighty? So this is the first one. Carlos, we can turn off the light. This is Anna's knee joint right here. This x-ray was taken with the DonJoy unloader brace on. But you can see it's a very subtle line. On some folks it's more obvious than others. On Anna, it's not so obvious, but you can still appreciate it. This is the outside, this is the inside of the knee. Her growth plate is right here. You can see the line right here. And then on the inside part of the knee, the growth plate is right here. It's right here. These are the growth plate. You can see them. So that what that tells me is that Anna's growth plate still being visible. Her knee is demonstrating the ability to disperse weight-bearing loads, because the growth plate is basically the space that separates softer tissue, which is up here, from the harder tissue when it's down here. Now, when the person loses this growth plate on an x-ray, what that tells the examiner is that this upper space here, which should have more pliability, has lost all that pliability. So now the individual is functioning with a lower leg bone, which up to the surface itself, the bone is very rigid, very dense. So whenever that individual is upright, those weight-bearing loads are not being dispersed properly. And that is the essence of this growth plate and what it tells you. As long as that individual has this differentiation separated by this growth plate, that individual's knee joint is operating at in a normal state. Pliable bone up here and harder bone down here. Now, let me show you another x-ray. We can turn the light on there. Now, you may say, well, as the individual, Carlos, you can go to me now. You may ask, and it's a good question, well, as you get older, it's normal for the individual to lose the growth plate. And my answer to that is no, it is not. No matter what age the individual is, that growth plate, that line on that knee should always be visible, no matter at what age. What I'm going to show you now is a classic example of what I'm saying. This is a 79-year-old patient. This is the right knee. This individual, the left knee was involved. The right knee was uninvolved. This right knee biomechanically was healthy. He was normal to normal knee extension. Now 79 years old, and you can still see the growth plate. It's right here. It's right here. It's right here. This 79-year-old patient on the uninvolved knee, the knee was perfectly healthy. There was no pain in it, and biomechanically healthy, normal. This individual still has a pliable upper bone region, which is up here, and a more mineralized, denser, harder lower bone region, which is down here, separated by the growth plate. As long as that individual has this growth plate, that individual is operating with a normal tissue state. Now, what I'm going to show you now is another. Again, you can turn that off, Carlos. This is an individual who I examined because she was experiencing some knee issues. We took the x-rays and the knee was biomechanically healthy. This case was just a simple tendinitis of the patella tendon. The knee was normal. We took the x-rays and you can see the growth plate. It's right here. It's right here. It's right here. It's, again, in this individual, it was very subtle, but it was still there. Again, this individual still possessed a pliable upper bone region and a harder mineralized lower bone region, which is what a normal knee joint would have. Now, I'm going to show you now a very involved knee joint. These types of knee joints always come with a growth plate obliterated. Now, what you can, this is a left knee. You can see how it does not have the normal structure of a knee joint. The growth plate is non-existent. It's nowhere to be found. You can see all this white right here. All this white right here. That means that this bone is mineralizing. It's becoming hard, dense bone tissue. You cannot see the growth plate. The growth plate is completely obliterated. This individual is functioning with a lower tibia, a lower leg bone that doesn't have that separation of pliable tissue, which should be up here, to normal dense tissue, which is down here. The growth plate, the dividing surface, that sign that individual is still functioning with a pliable upper bone and a harder lower bone, that sign which defines the normal state of that differentiation does not exist. Obviously, this individual was positive on all of the arthritic testing measurements. Now, what I'm going to show you now, we've seen this x-ray before. This is that professional athlete that's still functioning, who we examined because he had arthritis, or he was experiencing some pain in the knee. Now, the interesting thing is that this individual is operating at a very high level still, but you can see here that he's lost the growth plate. There's no growth plate. There is no defining lines here at all. It's very uniform. This individual does not have the upper pliability, bone tissue, and the harder, dense tissue below the growth plate, which should be right here. And you can see that it's obliterated. Now, this individual is still functioning, like I said, at a very high level, but just the fact that he was normal biomechanically, yet doesn't have this growth plate on x-rays, bodes very poorly for this individual. This individual, based on this sign, on this predictive sign, tells me that in the future, this individual has a very high probabilities of developing very severe arthrosis. Now, this is the most interesting x-rays I'm going to show you. This x-ray was the first x-rays we took. It was taken on April 15. This individual was complaining of knee pains. Biomechanically, it was minimally involved only. But when you do the x-rays, you can see that the growth plate, that line, is nowhere to be seen here. It's supposed to be right here. You see a little bit of growth plate right here. On the medial side, on the inside part of the knee, you see how uniform it looks. There should be a line going straight across it. There is none. So this individual has that positive arthrosis sign. That growth plate is obliterated. It's not there. At this moment in this person's life, it did not bode well. Her future had a very high probabilities for knee arthritis. Obviously, you see other signs of arthritis here. You see the lateral compartment here. There's some erosion of the bone over here. You can see it right here. Again, you can see the joint space width is compromised, more so on the left than on the right. You can also see a little bit of erosion right over here. But the most telling predictive sign that she's lacking is that growth plate, which should be right here. It's a very uniform bone tissue state. It's a very hard, dense tissue. Now, we treated this individual. She felt better. We took another x-ray. And look what happens. Overall, the x-rays look better, but the most telling sign of this improvement is the growth plate appearing now on the x-rays. You can see it especially on the right one. The growth plate is right here. You can see it starting to form right here. You can see it right here. You can still see a lateral, and you can see some semblance of it forming right here. This individual on July 9th, almost 4 months later, this individual's knee, she reported substantial improvements to the point where the knees really didn't bother her anymore. But the growth plate reappeared. This person went from a very dense, uniform tissue state on April to this separation of bone tissue states. Pliable upper, more dense on the lower segments. And you can see it here again. Again, anytime that this individual moved, stepped, walked, ran, the knee was able to disperse the stresses better because of this defining separation of tissue states, defined by the actual growth plate itself. Okay, Carlos, we can go over here. ¿Le puedes sentar, please? So, basically, this is what I'm saying. Knee arthritis conditions can be predicted if you know what you're looking for. So if you're out there and your knees are hurting and you go have a physical examination, make sure that when they take the x-rays, they look for that growth plate. If you have questions, if you want us to review your x-rays, if you want us to review your case, please, we always leave the phone on these videos. We leave an email also where you can contact us. We're here to help you. We're here to help you resolve your knee conditions. Knee arthritis is one of those conditions in the medical industry that's very predictive if you know what you are looking for. And to know what you're looking for, you have to have made some keen observations and followed it up and be able to establish patterns that exist in nature itself. So again, if you're watching this video, you're concerned about your knees or really any part of your body, but especially your knees based on this video, do not hesitate, make yourself aware, and just reach out and contact us. Until next time, thank you.